Hello, everybody. It is me, Leah, and welcome. Welcome to my new channel. Yes, I am all by myself. It's just me and you. And I have a new channel. And I want to invite you to join me on this journey. I've been meaning to do it for so long. Many of you know me from Hot Chicken, where I spend a lot of time hanging with my sister Laura and my husband Wayne and my friends, and we cruise and we scam bait and we do chit chat and we do whatever the heck we feel like, just to be perfectly honest. Here I thought I would try something new. Since I'm 67 years old, let's just say it, I'm kind of in a position where I should be retired, but I'm not retired because my finances haven't decided that that's time, just to be perfectly frank. And so I'm still working at the tender age of 67. And as many of you know, I work in the medical profession. No, I'm not a doctor. I'm not a nurse. I am not clinical. I don't diagnose. I have theories, but I don't diagnose. I work in a emergency room at the front desk, what we call patient access. I give the patients access to their clinical care. I guess is who comes up with these names? Admitting. That's what we used to call it back in the day. Admitting. Anyway, I admit that I'm confused. I have been in said profession in some capacity or another, in some office or another, for the last 35 years. I have been a phlebotomist. Hated it. That's the closest I've ever come to the clinical side of things. Hated it. Let me just say, you do not want your phlebotomist. Do you know what a phlebotomist is, by the way? Somebody that draws your blood. The ones with the sharp sticks. You don't want them coming at you like this. And for some reason, I was a shaker. I don't dislike needles. I don't mind my blood being drawn. They don't scare me. Why am I shaking? I don't know. But you don't want to see that. This was not my calling. I lasted maybe 6 months and decided I need to move on. Need to move on and do what I'm good at. And that is talking to people, lovely people like you that come in to see me, that need help, that need some comfort, that need their questions answered. Whatever. I am your girl. I am your girl. So I've been doing this currently in this one place for about 20 years. So I've been there a long time. I love my job. Would I retire if I could retire? Yeah, I would. Shh. But right now is not the right time. I just love the community. I love the patients that we serve. You get to know them. You come in, hey Joe, how you doing? How's Helen? How's the wife? How's the kids? The grandkids are here. That's great. It's a good place to work. I will be sharing stories on this channel. Which did I tell you? Sign in and sit down. That's the name of this channel. That's what I do all day long. Sign in, sit down. Sign in. Sometimes I want to say sign in, sit down, and shut up. But I don't. Never have. Never will. So that's the name of this channel. I am going to share stories from the ER. I'm not going to violate anybody's HIPAA rights. I am not going to break any social media policy rules that I may have governing me at my current job. Not going to do it. But going to just share some tips and tricks with you about when you go on your medical journey, what can make it easier for you. There are some funny little tidbits I can share from time to time. Also, I have spent my fair share of time on the patient side, as a lot of you might already know. In fact, the reason why I come to you with wet hair today and no makeup to speak of, I did throw on a little lipstick, is because I'm having surgery today. So I can't even. I just had surgery, not even on March 11th I had surgery in Utah. I still haven't even edited that video. I had an acoustic neuroma. I had a brain surgery. I had a thing removed, a craniotomy, not even a month ago. And here we are today. What are we having done today, Leah? Oh, well, your kidney stones. I have kidney stones. Let me just go back a little bit. I am being so random today. I can't even. But anyway, I started this kidney stone thing last year, which came to light right after my knee replacement. When I tell you I've spent my time as a patient, I have spent my time as a patient a lot lately. A lot. Anywho's, I had a knee replacement. That went great. It was fabulous. If you're waiting to do that and you're thinking, oh, I don't want to do it, Laura, my sister, you guys, you know my sister Laura? She needs one. She needs to do it. Anywho, shortly after that, like a week or two after that surgery, I started peeing blood. Now, I had just been referred to a urologist, and so I had seen him a few times, and so I sent him a message on the patient portal, and I said, look, I'm peeing blood. I'm not having any pain. I'm not having any symptoms of a urinary tract infection. Not having any of that. But I'm peeing blood. And I get no response. And then the bleeding stopped the next day, and I thought, okay, whatever. Well, a few days later, I'm peeing blood. This is not something you should be doing, peeing blood. So I message him again, and he writes back and he says, well, since you had your knee replacement and they had you on some blood thinners, that's why you're peeing blood. It's no concern. I'm like, well, isn't that interesting? I didn't get off on a good foot with this doctor. You know, you just get a vibe, just a vibey vibe, and you're like, I don't know if I feel comfortable with this doctor. But we don't have much choice in my area. So I kept going. I'm like, I got to get this figured out. And so weeks later, I'm messaging him going, still peeing blood, not taking blood thinners anymore, still peeing blood. And I finally got a response saying, well, I'm sure it's the blood thinners, but we'll go ahead and do an ultrasound. Basically, it felt like he was saying to me, if that's going to make you feel better. Of course, he didn't say that, but that's the vibey vibe I got. Like he was just trying to appease me. So we did the ultrasound, and lo and behold, I'm full of kidney stones. Full of kidney stones, right, left, big, little. 17 millimeter stone was the biggest one, which, if you know anything about kidney stones, that's not coming out by itself. So he calls, they make a follow-up appointment for this is like, okay, we can see you in 2 weeks or whatever. This has now been going on for probably 2 months. But so I go in, I see him at my appointment. He goes, yeah, you have kidney stones. I'm like, interesting. Interesting. And so let's schedule you for a procedure. We got to do what they call a lithotripsy, where they break the stone up. I don't know, they vibrate it, they do something, they crack it apart, and then you pass these stones. Anyway, I do not want to get into this whole story, but it was not pleasant. It was horrendous. This went on for months and months. We started this process in June, and it went through December. Just saying. I ended up in the hospital with a blood infection from this situation. And all the time, I felt like this doctor was gaslighting me. Once I got out of the hospital with this blood infection, I had a follow-up with him in his office the next day where he was going to take these stents out from the kidney stones. And so he did that. He took another x-ray. He goes, we got all the stones. You're good. No follow-up appointment. No nothing. No, I'm sorry you were in the hospital for a week with a blood infection that I caused. Or I'm assuming he might have caused. But at any rate, I thought, you know what? No, I'm still having multiple urinary tract infections. I want to follow up with somebody different. And although in our area, there aren't many choices, I decided to go to a neighboring town and see another group of urologists. And so I went and saw him. Very nice young man. They're all babies. I'm telling you, as I get older, these doctors are 12. They're 12 years old. This guy's 12, maybe 13. Anyway, very nice. Sat down, looked at me when he talked to me. He burned a hole in my head looking into my eyeballs, listening to every word that I said. And he finally said, well, I know he did the x-ray. He goes, but I really want to do another CT scan to see, let's just make sure everything's cleared up and just see where the dust has settled, so to speak. And we'll see you again after that CT scan and we'll go from there. Had the CT scan. Hell, if I still have stones. The largest one, 6 millimeters, can't pass on its own. Not good. Anyway, so Dr. Doogie Hauser, my 12-year-old, 13-year-old doctor, says, okay, well, we're going to go in. We got to do another procedure and get this stone removed. He goes, you're not going to like me because it hurts and it's not fun. It hurts and it's not fun. And I got to go today. I got to be there. What time is it? I got to be there at 11:30 to check in for a 1:30 surgery. And I got to go back to work on Monday because I'm still on medical leave from the last surgery. You guys. Anyway. That's what I'm doing today. I've gotten so far off track. I just want to welcome you to the new channel. We're going to share medical stories. We're going to talk about how to make your medical journeys easier and breezier and lemon squeezier, and just have a good time and just talk and hang out. And yeah. Oh, but the last thing, I'm going to jump back. If you have a doctor and you feel you are not feeling 100% confident in the information that you're receiving, or you feel like you're being gaslit or written off, or like you're just causing trouble, which is how I felt all the time with this other doctor. I felt, and I am good. I don't need somebody gaslighting me. You know why? Because I do it to myself. I do it enough to myself for everybody else. You don't need to gaslight me because I'm going to do it to myself. Just saying. But if you do not feel comfortable, do not feel bad. I know at our age, at our tender ages, and if you're younger, probably you do it too. I don't know. But we were brought up that the doctors, if the doctor said something, that was what it was, and that was law, and you did this and you did that, and you never questioned it. So you have to question it. And if you are not feeling comfortable, get a second opinion. Fire their asses and go someplace else where you do feel validated and heard, and you do feel like you're getting the care that you need. It's so important. You have to be your own advocate. And if you can't be your own advocate, then get somebody that can. Have a family member, a friend, somebody, anybody. Get somebody to be there to speak for you or to help you if you don't feel comfortable asking the questions. Somebody that can help you ask those questions. It's so important. It's so important. But anyway, I went off again. You let me go off. You're supposed to say, Leah, stay on track. Anyway, I've got to get going. I'm having surgery in case you didn't hear. But I want to welcome you. We're going to hang out. I start work again on Monday from my break, from my medical break, unless this goes poorly and oh God, I don't even know. But yeah, welcome. If you haven't already, hit that subscribe button because, yeah, join the sit down and shut up. Sign in and sit down family. Because you know you want to be a member of this family and this community, because where else can we talk about this crap? I love you guys. I want to thank you for stopping by today. And yeah, I'll let you know. I'll check in with you tomorrow. Let you know how the surgery went. All right, you guys, subscribe, hit the like button, tell YouTube that you're here, and hit that notification bell because who knows when we're going to go live? Who knows when we're going to post a video? You will if you hit that notification button. All right, you guys, love you all. See you soon. Bye. Hello, everybody. It is me, Leah, and I'm trying to, I've got I'm not well lit. I've got a window behind me. I'm in my husband's studio because I myself have no studio. And can I just say, how many of these things can one man have? Things. I don't know. I digress. Anyway,